Hi my dear doctors, today we are going to discuss about some questions from embryology from first aid. So let's begin the question. A physician is asked to elevate a 5-year-old girl who has developed a mass in her neck. During the interview, he learns that the mass appears within the past few months and has been enlarging. However, it causes no pain or discomfort. The mass is in the midline of the neck, just inferior to the hyoid bone. Laboratory test reveals a triiodothyronine level of 150 nanogram per deciliter, a thyroxine level of 8.0 microgram per deciliter, and the thyroid stimulating hormone level of 1 microunit per ml. A CT scan of the neck is performed and the doctor recommended surgery. Which of the following is the most likely diagnosis? Number first question answer, that is the brachial cyst. Number second, dermoid cyst. Number third, ectopic thyroid gland, enlarged pyramidal lobe of the thyroid, lipoma, or thyroglossal duct cyst. So here the parameters of the thyroid hormone, that is the tyrosine level, the triiodothyronine level, and the thyroid stimulating level, they are according to the normal. Okay, they are all normal condition in normal, and the mass which is found mostly it is present at the midline and it has no pain and no discomfort. So before going through the answer, I will explain a little bit about the development of the thyroid gland and the descent of the thyroid gland. So during the embryological development, if we see that just inferior to that of the pharynx or just inferior to the primitive tongue, there is a space or there is a place where the formation of the diverticulum or the thyroid diverticulum. The thyroid diverticulum first formed just inferior to that is called as the foramen cecum, which is the remnant of that place. Okay, for example, this is a thyroid diverticulum. So the thyroid diverticulum slowly during the development it's come down and it's fixed to its normal position. So in some conditions, when the development and the descent of the thyroid gland fails, it does not come to its original position. Okay, somewhat stick here, somewhat it stop its descending at any place here. At that condition, in most of the patient, the thyroid does not perform its function well. So in such conditions, when the thyroid fail to descend down, that is called as ectopic thyroid gland, and in that condition there will be hypothyroidism. The level of the hormone start to decrease, but in our question all the parameters of the thyroid hormone, they are according to the normal. So this patient is not suffering from ectopic thyroid gland. So what would be the other causes? So other causes may be some other descending defect or some other conditions that will understand in after discussing this question, after discussing this image. So during the descent down, from here I said there is a formation of foramen cecum, there is a formation of diverticulum of the thyroid gland, then this thyroid gland start to descend down to its normal position. But during this descending, it follow a pathway that is called as thyroglossal. Okay, this is what called thyroglossal. It is a pathway, we can say it is a pathway which show the thyroid diverticulum to descend down to its normal position. After when the thyroid gland reach to its normal position, this remnant or this thyroglossal ligament or this thyroglossal structure, it disappears. But some conditions in some patients, they fail to disappear and it persists into your neck region. But the most common location of this is the midline of the neck. If I see like this during the developmental formation, here I have the pharyngeal pouches contributing the formation of your face and neck region, but here is the pharynx. Okay, just below this the formation of the diverticulum, it start descend down to its normal position. But this pathway through which the thyroid gland come down, and this is called is the thyroglossal pathway. Okay, it is a thyroglossal duct through which the thyroid gland come down. But some condition it does not disappear, it does not undergo the process of degeneration, it remains and it persists until birth and after birth. So in that condition, the patient feel that something is present in the midline of the neck, and that is painless and little bit movable. So it is just present in the midline of the your neck. That condition is called as thyroglossal cyst, and the most commonly it just present just below the hyoid bone, and a patient seems like this in the midline of your neck. Okay, in the midline we can see here a mass. So this is called as thyroglossal cyst. So go back to the question. So what about the brachial cleft cyst? The brachial cleft cyst is also common, but it is not necessary that it is always present into the midline of the neck. So this question we can answer is we can eliminate this one. Number second, dermoid cyst. Dermoid cyst is freely movable, and it is more movable than that of the thyroglossal cyst, and it is mostly present on the more superficially than that of the thyroglossal cyst. Ectopic thyroid gland, no, because all the parameters of the thyroid function, they are normal, so patient don't have any sort of ectopic thyroid gland. Enlarged pyramidal lobe of the thyroid. In this condition, thyroid go hypertrophy, and so the thyroid hormone, especially T3 and T4, and their level should be increases, but in this condition the level are normal. And lipoma is not necessary to form only at the middle line, and it is not related to the embryology. It may be formed after the birth due to some other conditions. So the most specific answer in this condition is that this patient may be suffering from thyroglossal cyst. So the answer should be thyroglossal cyst.